Choosing a behavioral health EHR is one of the highest stakes calls an operator makes. Get it wrong, and you face months of painful migration, staff retraining, and revenue disruption. The platform you select touches admissions, documentation, billing, compliance, and facility management. Every part of daily operations. Welligent, now part of ContinuumCloud, versus Behave Health. Here is how the two platforms compare for behavioral health operators evaluating the switch. We compare the two across CRM, EHR, RCM, and billing, and operational capabilities, based on publicly available information as of April 2026. Welligent has operated in the behavioral health EHR market for some time and is now associated with ContinuumCloud, a broader behavioral health software portfolio. The ContinuumCloud product family, which includes the Welligent EHR, also appears to encompass workforce management and patient engagement tools. Behave Health takes a different approach, combining CRM, EHR, RCM, and ERP into a single platform built for addiction treatment and behavioral health. Get the EHR decision wrong, and the cost is not abstract. Months of painful migration, staff retraining, and potential revenue disruption while you recover. When admissions, documentation, and billing live in separate tools, the handoff gaps slow admissions and create billing errors. When documentation and billing do not share the same data, the risk of claim denials goes up. In Behave Health, a patient record created during the admissions inquiry can flow directly into clinical documentation and billing without duplicate data entry. RCM is integrated into the clinical workflow, so documentation supports billing from the point of care. The EHR is built for the clinical workflows addiction treatment and behavioral health programs require. 4 areas decide whether a platform fits your organization: admissions, clinical workflows, billing, and the operational layer outside the record. Let us walk through each one, using the platform's publicly available capabilities as the basis for comparison. First, the admissions CRM, the revenue engine for any treatment center. ContinuumCloud appears centered on clinical documentation and EHR, rather than a dedicated CRM. Speed to admission workflows would be assembled outside it. Behave Health's CRM is purpose-built around admissions, online applications, instant VOB, lead and referral tracking, census management, and alumni tracking. Second, clinical documentation and treatment planning, the core of any behavioral health EHR. For ContinuumCloud, workflows like ASAM placement, COWS COA scoring, and integrated medication pass are not clearly documented as standard. Behave Health includes ASAM assessments, COWS and CWA scoring, group notes, e-prescribing via Doctor First with EPCS, and integrated drug testing. Third, revenue cycle management, clean claims and denial management make or break financial health. ContinuumCloud's RCM appears limited compared to dedicated billing solutions. Organizations may need third-party billing. Behave Health integrates eligibility verification, claims submission, ERA/EOB processing, denial management, and utilization review. Fourth, and the most significant difference, what happens outside the clinical record. For ContinuumCloud, property management, vehicle tracking, and maintenance scheduling do not appear to be part of the platform, though workforce tools do. Behave Health adds an ERP layer, property management, HR and credentialing, vehicle management, maintenance scheduling, and community and vendor contacts. The two also differ in the breadth of organizations they support across the continuum of care. ContinuumCloud appears to serve behavioral health facilities, community mental health centers, and human services organizations. Behave Health serves those plus residential, IOP, PHP, detox, recovery residences, sober living, RCOs, drug courts, and NAR affiliates. If you run recovery housing alongside clinical services, it is designed to support the full continuum without a second platform. If you are a current Welligent user weighing whether to stay or switch, Behave Health provides a structured migration path designed to protect your operations. Our team handles data migration, staff training, and parallel go-live support, so the transition does not disrupt operations. For Welligent login, support, or status, contact Welligent directly. This guide is for operators comparing alternatives. The post identifies the most common reasons behavioral health organizations explore Welligent alternatives. Wanting one modern platform that combines CRM, EHR, RCM, and ERP, rather than stitching together separate systems. Needing a dedicated admissions CRM with lead tracking and referral analytics to drive speed to admission. Expanding beyond community behavioral health. and wanting operational tools in the same platform as the EHR. Behave Health consolidates documentation, admissions, billing, and operations, so the work and the data stays in one connected system. When documentation and billing share the same data, the risk of gaps that lead to denials drops significantly. The ERP layer is designed to replace the patchwork of spreadsheets and separate property software. Admissions, documentation, billing, operations, and alumni tracking are designed to work together. Stop piecing together disconnected systems. See how the all-in-one platform compares to Welligent in a 20-minute demo at behavehealth.com. See the CRM, EHR, RCM, and ERP layers, plus the structured Welligent migration path at behavehealth.com.